Are you ignoring these 7 areas of the body after 70? The price may be too high. Did you know that more than 70% of seniors develop at least one skin infection after age 70? Have you ever stopped to think that small changes in your hygiene routine could avoid weeks of antibiotic treatment? What if I told you that there are areas of your body that need special attention every day, even when you don't take a full shower? After the age of 70, our body undergoes silent transformations that many ignore until it is too late. The way we take care of our hygiene can be the difference between a healthy, independent life or serious medical complications. When we age, our skin becomes a fragile ally that requires specific and consistent care to protect us properly. Many elderly people end up hospitalized for infections that could be easily prevented with a proper hygiene routine. Today, I will reveal the 7 areas of the body that require daily attention after the age of 70 and how to take care of them properly. Let's get started. The shocking truth: why your skin changes drastically after 70. Our skin undergoes a silent metamorphosis when we reach the age of 70 that few doctors adequately explain. The sebaceous glands drastically reduce their production, leaving the skin drier and more vulnerable to microscopic cracking. The skin's natural barrier, which once protected us efficiently, weakens and allows bacteria and fungi to enter more easily. Studies by the American Association of Dermatology show that cell turnover decreases by up to 60% at this age. Every day that passes without proper care, you're essentially leaving the door open for invading microorganisms. The thickness of the skin decreases significantly, making it more fragile and prone to injury with even the slightest trauma. The cutaneous immune system also becomes less efficient, reducing the ability to fight local infections quickly. Hormonal changes affect the pH of the skin, creating a more favorable environment for the growth of opportunistic pathogens. And most worryingly, many seniors don't notice these changes until an infection is already installed and causing problems. But what if you knew exactly how to protect every inch of your skin against these invisible threats? The invisible enemy. How your skin ages and opens doors to infections. Every decade after the age of 50, we lose approximately 10% of the collagen fibers that keep our skin whole. This loss accelerates dramatically after 70, creating microcracks invisible to the naked eye but perfect for bacteria. Blood vessels become more fragile, reducing the supply of nutrients and defense cells to the surface of the skin. The ability to heal decreases by up to 40% according to research by the National Institute on Aging. Each scratch, no matter how small, becomes a potential gateway for infections that can become systemic. The folds of the skin deepen and create moist and dark environments, perfect for the proliferation of fungi and bacteria. Elastin, the protein responsible for skin elasticity, progressively degrades, creating areas of redundant skin that overlap. This overlap forms pockets where sweat, dead cells, and microorganisms accumulate away from the eyes and cleaning products. Sweating changes its chemical makeup, losing some of the natural antimicrobial peptides that once protected us. Have you ever wondered why some people age with healthy skin, while others face recurrent infections? Transform your routine, the hygiene revolution that can save your health. Geriatricians at the University of Michigan have found that small changes in hygiene routines reduce skin infections by up to 70%. Adapting your hygiene does not necessarily mean more time in the bathroom, but strategic attention to the most vulnerable areas. Consistency outweighs intensity when it comes to hygiene in old age, as proven by recent longitudinal studies. Establishing a personalized routine is essential to maintain the integrity of the skin without causing excessive dryness. Science proves that 3 minutes a day dedicated to specific areas prevents weeks of antibiotic treatment. Many products we used when we were younger can now be harmful due to changes in pH and skin sensitivity. The temperature of the water also matters much more now, as very hot water removes the few natural oils that are left. Simple adaptive tools can transform a challenging routine into something pleasurable and efficient for seniors. The benefits go beyond infection prevention, including improved circulation, comfort, and even psychological benefits. But are you ready to know the detailed map of the 7 areas that require your daily attention? Secret revealed: how the right hydration blocks dangerous infections. Skin hydration after the age of 70 is not just a matter of comfort, but an essential immune defense strategy. Researchers at Stanford University found that well-hydrated skin has 200% more resistance against common pathogens. The hydrated layer maintains its structural integrity, functioning as a physical barrier against invading microorganisms. Intercellular lipids, when properly maintained, form an impermeable matrix that prevents the penetration of bacteria and fungi. Hydrated skin preserves its natural microbiome, that army of beneficial bacteria that protects us on a daily basis. Many older adults make the mistake of moisturizing only visible areas, ignoring critical regions such as folds and interdigital spaces. The ideal time to apply moisturizer is within 3 minutes after showering, when the skin is still damp. Moisturizers with ceramides and hyaluronic acid not only moisturize but help restore the damaged skin barrier. Nighttime hydration is particularly important, as it is during sleep that much of the skin's cell regeneration occurs. What if there was a way to maximize the benefits of hydration with specific ingredients for each region of the body? Zone 1. The hidden folds that can become fertile ground for bacteria. The armpits and skin folds are true incubators of infections when neglected, especially after the age of 70. In these areas, sweat accumulates and does not evaporate easily, creating an ideal moist environment for fungi such as Candida albicans. The folds under the breasts in older women are particularly vulnerable to intertrigo, a painful inflammation caused by friction and moisture. The abdominal folds in overweight people form hidden chambers where ventilation is virtually non-existent. Each fold of skin hides a microclimate of its own that can become a hotspot for dermatitis if not cleaned daily. The inguinal region concentrates glands that continue to produce secretions, even when the overall sweat production decreases with age. Washing these areas requires gentle, circular motions, gently pulling away the folds to reach the surfaces in contact. After cleaning, thorough drying is absolutely essential, preferably using a soft towel with light touches. Specific antimycotic talcs for the elderly may be recommended by dermatologists for areas with a history of recurrent infections. Did you know that there is a specific drying technique that reduces the risk of skin fold infections by 80%? Zone 2. The intimate region that should never be neglected, even if it is difficult. The genital and perianal region undergo significant changes with aging that increase their vulnerability to urinary and fungal infections. In older women, reduced estrogen levels cause vaginal atrophy, making the tissue thinner and susceptible to irritation and infection. Men over the age of 70 often develop prostatic problems that can make it difficult to empty the bladder completely, creating an environment conducive to bacteria. The perianal region requires special attention, as decreased muscle tone can make proper hygiene difficult after bowel movements. Incontinence, even if mild, completely transforms the needs of intimate hygiene in old age. Products with a specific pH for the genital region help maintain the balance of the local microbiota and prevent opportunistic infections. Cleaning should always be performed from front to back, especially in women, to avoid contaminating the urethra with intestinal bacteria. Cotton underwear and daily changes are essential to keep the area dry and well ventilated. Sitz bathing can be an alternative for days when complete bathing is not possible, ensuring the hygiene of critical areas. Could you spot the early signs of a UTI before it becomes a serious problem? Zone 3. The silent danger between your toes. The spaces between the toes are true havens for dermatophyte fungi, responsible for athlete's foot and other mycoses. After the age of 70, peripheral circulation decreases considerably, reducing the natural defense mechanisms in the feet. The decrease in flexibility makes it difficult for many older adults to properly reach this region while bathing. The moisture trapped between the toes can persist for hours, creating ideal conditions for fungal proliferation. A study by the American Society of Podiatry revealed that 80% of seniors have foot fungus without knowing it. Toenails become thicker, and more difficult to cut, which can create lesions on the sides that serve as a gateway for infections. Using a small towel or flexible cotton swabs to dry between your fingers can make all the difference. Improper footwear aggravates moisture and pressure problems, creating microtraumas that facilitate fungal and bacterial infections. Cotton socks or moisture-wicking materials should be changed daily, even if they don't look dirty. Have you ever wondered how a simple adaptation to your foot drying routine could prevent months of antifungal treatment? Zone 4. Your face is crying out for help. Signs you're ignoring. The face and scalp undergo dramatic changes after the age of 70, including increased dryness and decreased natural sebum production. Many seniors continue to use the same facial cleansers as they did in middle age, which can now be overly harsh. The scalp becomes thinner and more sensitive, necessitating shampoos formulated specifically for mature skin. The region around the eyes and mouth has more wrinkles and folds where residues, dead cells, and microorganisms can accumulate. Facial cleansing techniques that worked in their 50s may be compromising your skin barrier now. Dermatologists recommend sulfate-free facial cleansers with a slightly acidic pH to preserve the hydrolipidic mantle. Warm water, never hot, is essential so as not to exacerbate the natural dryness that accompanies aging. Gentle massages during cleansing help stimulate circulation and improve nutrient supply to skin cells. The nasolabial angle and the folds around the nose are often neglected, becoming foci of seborrheic dermatitis. Do you know the Japanese cleansing technique that is revolutionizing facial care for people over 70? Zone 5. Your hands tell a germ story you need to hear. Our hands are the parts of the body that come into contact with contaminated surfaces the most, becoming vectors of microorganisms. After the age of 70, the skin of the hands loses up to 50% of its thickness, making it more vulnerable to microtrauma. Nails and cuticles become more brittle and prone to fissures that serve as gateways for bacteria. The subungual spaces accumulate a surprising amount of microorganisms that can be transferred to food and the face. Every millimeter of your hands carries a bacteriological history that can compromise your overall health. The correct hand washing technique includes special attention to the cuticles, spaces between the fingers, and the bottom of the nails. Seniors with arthritis can benefit from soft bristled brushes to clean their nails without causing joint discomfort. Frequent moisturizing of the hands prevents microscopic cracks that serve as gateways for infections. Studies show that most respiratory infections in the elderly begin with the transfer of pathogens from the hands to the face. Are you really washing your hands for as long as it takes to eliminate the toughest pathogens? Zone 6. The forgotten corner that can cause painful infections. The ears and external ear canal are often overlooked in the hygiene routine, especially by people who wear hearing aids. Cerumen changes its composition with age, becoming drier and more prone to impactions that can harbor bacteria. The skin of the ear canal is extremely thin and delicate, especially in the elderly, making it vulnerable to infections such as otitis externa. Many make the dangerous mistake of using cotton swabs deep into the ear canal, causing micro-injuries and pushing the earwax inward. The combination of moisture and heat in the ear canal creates a perfect environment for rarely diagnosed fungal infections. Otolaryngologists recommend cleaning only the visible part of the ear, using a damp cloth and mild soap during bathing. Hearing aids should be cleaned daily, according to the manufacturer's instructions to avoid colonization by microorganisms. Otitis externa, known as swimmer's ear, is particularly common in older adults who do not properly dry their ears after bathing. Signs such as severe itching, pain, or discharge from the ear should be evaluated immediately by a healthcare professional. Did you know that there is a simple technique for drying the ears that prevents 90% of ear canal infections? Zone 7. The back, the hygiene blind spot that few can reach. The back represents the largest surface area on the body, and ironically, the most difficult to reach properly during hygiene. After the age of 70, shoulder mobility decreases significantly, making it nearly impossible for many seniors to wash their own backs. The interscapular region accumulates sweat and dead cells, creating an ideal environment for bacterial folliculitis and other skin infections. The lower back, especially in the lower back, develops deeper folds with aging, where moisture can be retained. Every inaccessible area of your back can become a point of vulnerability for your health if ignored in your daily routine. Adaptive tools, such as long-handled brushes, are essential investments to maintain independence in personal hygiene. Applying antimicrobial lotions to the back may be a recommended preventive strategy for older adults with a history of folliculitis. Complete drying is key, as residual moisture on the back can take hours to evaporate naturally. Regular observation of the back with magnifying mirrors, or with the help of caregivers, allows skin problems to be identified early. Have you ever considered how small adaptations in your routine can solve this blind spot in your personal hygiene? Arsenal of protection. The tools and products that every elderly person needs to have. The proper choice of hygiene products can be the difference between healthy skin and one prone to infections in old age. Synthetic soaps with a pH between 5 and 5.5 are ideal for preserving the protective acid mantle of aging skin. Products with artificial fragrances should be avoided, as they increase the risk of irritations and contact dermatitis on sensitive skin. Loofahs and natural sponges are veritable reservoirs of bacteria and should be replaced with antibacterial synthetic alternatives. Skincare science has evolved to create specific formulations that respect the biological needs of aging skin. Ergonomic tools, such as bath brushes with long handles, allow you to reach difficult areas without compromising balance. Non-slip bath stools transform the bathing experience from a moment of risk to a moment of safe relaxation. Microfiber towels are more efficient at drying and less abrasive to fragile skin than conventional cotton towels. Shower systems with removable hose facilitate targeted hygiene for specific areas without wetting the entire body. Have you ever wondered why some products promise a lot, but deliver little when it comes to mature skin? Rebuild your space. Simple bathroom transformations that can save lives. Bathroom design can be the greatest ally or the worst enemy of proper hygiene after 70 years. Strategically placed grab bars are not signs of fragility, but smart tools to ensure safety and independence. Proper lighting is essential for skin inspection and early detection of problems such as redness or initial lesions. Non-slip mats eliminate the fear of falls that many seniors associate with bathing, allowing them to concentrate fully on hygiene. Every element of your bathroom can be optimized to promote more efficient and safer hygiene in old age. Magnified, well-placed mirrors allow for the inspection of areas of the body that would otherwise go unnoticed. Affordable product organizers eliminate the need for sudden movements that can cause imbalance while showering. The ideal height of the toilet facilitates proper intimate hygiene and reduces strain on the knee and hip joints. Space heating systems prevent thermal shock that can be dangerous for elderly people with cardiovascular conditions. Have you ever wondered how small changes in your bathroom could completely transform your daily hygiene experience? When you can't do it alone, the essential guide for caregivers on dignified hygiene. Accepting help for personal hygiene is one of the biggest emotional challenges faced by many older adults with reduced mobility. Professional caregivers are trained to respect dignity and privacy while ensuring proper and complete hygiene. Clear communication about personal hygiene preferences establishes trust and preserves autonomy even when assistance is needed. Strategies such as covering areas that are not currently being washed help minimize discomfort and preserve dignity. The art of respectful care transforms a potentially embarrassing moment into an experience of human connection. Safe transfer techniques for bathing prevent injuries to both the elderly and the caregiver during the hygiene process. Maintaining a pleasant room temperature and avoiding prolonged exposure are essential to prevent hypothermia in frail older adults. Leave-in cleansers are valuable alternatives for days when full bathing is not possible or recommended. Close observation of the skin during bathing allows caregivers to identify signs of potential problems early. How would you react if you needed help with your personal hygiene? Have you considered discussing your preferences with your family members? The myth of the daily bath. What is the ideal frequency that no one told you? The concept that full daily baths are necessary for all seniors is a myth that can cause more harm than good. Dermatologists at the Mayo Clinic recommend full baths only 2 to 3 times a week for seniors with very dry skin. Targeted hygiene of the 7 critical areas should be carried out daily, regardless of the frequency of complete baths. Very frequent or prolonged baths remove natural essential oils from the already compromised skin of the elderly. The perfect balance between cleansing and preserving the skin barrier is the secret that few doctors share. The ideal temperature of the water for bathing the elderly is between 32 and 35 degrees, warm enough to clean without drying out. Baths in the morning stimulate circulation and improve mood, while night baths can help with sleep quality. Shower time should be limited to a maximum of 10 minutes to avoid excessive dryness of the skin. Partial cleaning techniques, such as sitz bathing and armpit hygiene, can be alternated with full baths. Have you ever considered how Western culture has conditioned us to hygiene practices that may not be the most suitable for aging skin? Red alarm, signs on the skin that require immediate medical attention. Certain skin changes should never be ignored, as they can indicate infections that quickly become serious in the elderly. Redness that spreads, especially if accompanied by local heat, can be a sign of bacterial cellulitis that requires antibiotics. Spots that do not lighten with finger pressure may indicate bleeding under the skin that needs urgent evaluation. Intense itching that disrupts sleep may be the first sign of scabies or other parasitic infestations common in long-term care settings. Wounds that do not heal within 2 weeks, even small ones, may indicate undiagnosed diabetes or vascular insufficiency. The first signs of serious skin infection often appear as subtle changes that many mistake for normal aging. Unusual odor, especially in skin folds, can indicate fungal infection that requires specific treatment and not just better hygiene. Changes in skin texture, such as unusually rough or scaly areas, can be early signs of precancerous conditions. Skin rashes that appear after initiation of new medications should be reported immediately to the prescribing physician. Asymmetrical swelling, especially in the legs, may indicate circulatory or infectious problems that require urgent evaluation. Would you be able to identify when a skin spot is just part of natural aging or a warning sign? Independence is possible. How to maintain your dignity and health in the golden years. The journey to proper hygiene after 70 doesn't have to be complicated or daunting when approached correctly. Every little adjustment to your hygiene routine is a direct investment in your health, independence, and quality of life. The changes we implement today can prevent serious complications tomorrow, keeping you active and independent for longer. Remember that taking care of your hygiene is not only a matter of physical health, but also of emotional well-being and dignity. The real secret to aging with grace lies in smart adaptation, not stubborn resistance to necessary change. Many people in their 80s and 90s maintain healthy, infection-free skin by following exactly these guidelines. Allow yourself to accept small aids and adaptive tools before larger problems require more invasive interventions. Every area of the body that you diligently care for is a victory against the opportunistic infections that threaten your independence. Share this knowledge with other seniors in your community, as many suffer in silence with preventable skin problems. Old age brings challenges, certainly, but it also brings wisdom to adapt and continue to thrive. You deserve to live your golden years with dignity, comfort, and health, and a proper hygiene routine is a fundamental pillar for this. Start today by implementing these changes, one area of the body at a time, and watch as your well-being transforms. Because aging well isn't just about adding years to life, but adding life to years. And that starts with taking care of your skin on a daily basis.